Dear students, good morning. Let's start our pathanatomy lecture. Topic today: infection, viral disease, part number 2. On the last lecture, we'll talk about respiratory viral infections, and now we will discuss childhood viral infections, measles, chickenpox, and next disease, acquired immunodeficiency syndrome. So about measles. Measles, this is acute, highly contagious viral disease, viral childhood disease with symptoms. Next symptoms, characteristics: catarrhal inflammations of the mucous membranes of the upper respiratory tract. Catarrhal inflammation, upper respiratory tract. Next, conjunctivitis, stained papular rash of the skin, and general symptoms: intoxication and fever. About etiology and pathogenesis. Etiological factors: RNA virus, PARAMYXAVIRUS family, PARAMYXAVIRUS. The source of infection: a sick person. Mechanism: pathways, airborne. The entrance gate: mucous membranes, upper respiratory tract, entrance gate. Mucous membranes or sometimes conjunctiva. Pathogenesis. In the epithelium of the mucous membranes, virus cause dystrophic change in the mucous membranes, and next, virus enters to the bloodstream, spread then, and appear in lymphoid tissue, causing immune restructuring in it. Virus has the ability to reduce the barrier function of the epithelium, reduced phagocytic activity, That's why increase the tendency of patients to secondary infection. Pathomorphological change include catarrhal inflammation on the mucous membranes of the pharynx, trachea, bronchi, and conjunctiva. Catarrhal inflammation signs: mucous membrane is swollen, full-blooded, hyperemic, and secretions of mucus is increased. This is a macroscopic picture, catarrhal inflammation on the pharynx. Next, morphological signs: exanthema, rash on the skin, rash on the skin. Exanthema has a spotly-papular character, occurs on 4 or 5 days of illness. spotty papular character, maybe macular-papular character, appears behind the ears, face, localizations of the rash, face, neck, and then spreads to the skin of the trunk and limbs. Microscopically, in the exanthema, hyperemia, signs hyperemia of microvessels, perivascular infiltration by lymphocytes and histiocytes, inflammatory infiltration, lymphocyte and histiocytes, diapedesis, hemorrhage, small hemorrhage, diapedesis. Next, para and dyskeratosis, and vacuolizations of the epidermis, Next, morphological signs, enanthema. Enanthema with small whitish dots, surrounded by a halo of hyperemia. Surround hyperemia. Enanthema in the area of a transitional fold near the small molars is called Filatov Koplik spots. Here's on name called Filatov Koplik spots. Enanthema with localizations in the area of a transitional fold near the small molars. Next signs, change in the lungs. In the interalveolar septum, formation miliary and submiliary focus of lymphoid, histiocytic and plasma cells proliferation in the interalveolar septum. Formation interstitial pneumonia and appear giant cells measles pneumonia. Morphological change in histology. Giant cells appear, accumulations of giant cells in the lung. Different morphological change in measles, change on the skin rash, on the mucous membrane, change in the lung, the formation pneumonia. Complications include additions of the secondary viral or bacterial infection, and for example, panbronchitis, necrotic or purulent necrotic nature, panbronchitis, and peribronchial pneumonia, secondary viral bacterial infection. Next complication, Fell's group and asphyxia. Fell's group, this is edema and necrosis of the mucous membranes of the larynx with a reflex spasm of its muscles. edema, necrosis, and spasm of the pharynx. And what's why? Complication asphyxia. Next complication, noma. This is a wet gangrene of soft tissue over face. Wet gangrene of soft tissue over face, noma. Next, complications in digestive system and nervous system. In digestive system, stomatitis, enteritis, and colitis. In nervous system, meningitis and encephalitis. Meningitis and encephalitis. Next disease, chickenpox or varicella. Chickenpox or varicella. Chickenpox is an acute infection disease of children. Acute infectious disease of children, characterized by a spotty vesicular rash on the skin and mucous membranes. Chickenpox, characterized by spotty vesicular rash on the skin and mucous membranes. Etiological factors, causes, DNA virus, group herpes viruses, source of infection is a sick person, transmission by airborne droplets, virus enters the respiratory tract, next enters to the bloodstream, spread in bloodstream, and reproduce during the incubation period. Macroscopic picture on the skin. Appear of a rash on the skin. Rash, reddish, elevated. Rash in the form of spots, center of which is a vesicle formation, center present vesicle with transparent contents is quickly formed. At first, spots, center vesicle. When the vesicle dries, it centers sinks and becomes covered with a brownish or blackish crust. Vesicles located mainly on the body and scalp. Typically, presence of elements of different prescriptions, which creates or variation of skin rash. You can see dynamics of chickenpox rash. One day and during 2 weeks of illness. You can see polymorphism of elements, polymorphism of chickenpox rash. Spots, papula and vesicles and formations crust. Polymorphism of elements. Microscopically, process of skin vesicle formation begins with balloon dystrophy. Over spinous layers, over epidermis, and appearance of giant multinucleate cells. Balloon dystrophy over epidermis and appearance giant multinucleate cells. Here on balloon dystrophy and inflammatory infiltration. The death of the epidermis leads to the formations of small cavities in the epidermis, cavities merging, and formations vesicles filled with serous fluid. On the surface, on the epidermis, formation vesicles filled with serous fluid. Here's on edema and formation, accumulation serous exudate, serous fluid with formation vesicles. Complications of chickenpox include atypical form with disease, hemorrhagic form, bulbous form, and gangrenous form. Hemorrhagic form formation vesicles with hemorrhage exudate and maybe hemorrhage, bleeding. Bulbous form formations vesicles of big size, very big size vesicles. And gangrenous form characterized by purulent inflammation, formations of abscess and deep ulcers. Next complication, viral pneumonia. Next, encephalitis. Next, additions of purulent infections. For example, gingivitis, stomatitis, conjunctivitis, lymphadenitis, keratitis, otitis. Next complication, sepsis. Fales group and glomerulonephritis sometimes. Next disease, HIV infection. This is slowly progressing infectious disease caused by human immunodeficiency virus, which has a polymorphic clinical picture, with the development of acquired immunodeficiency syndrome. Development of acquired immunodeficiency syndromes in the final stage, with total depressions of immune system. Total depressions of the immune system. Final with disease, always death. With infections as a global epidemic. Global epidemic. Etiology: human immunodeficiency virus. This is RNA virus. RNA virus. Family retrovirus. Retrovirus. And subfamily lentivirus. Lentivirus. Subfamily. About pathogenesis. HIV infections occurs with contact, local, directly contact person, directly contact person with infect material. Directly mechanism, directly contact person with blood or mucous membranes, infected blood or mucous membranes. Directly contact must be. Virus infects primarily CD4 lymphocytes, helpers. Virus infects primarily CD4 lymphocytes, CD helpers. Attack in helpers. Damage of T helpers results in decreased macrophage activity. Damage of T helpers results in decreased macrophageal activity, decreased antibody production by B cells, decreased antibody production by B cells, and it leads to the lowering, decrease of the immune response. Decrease of immune response. Source of HIV infection: infected person at all stages of the disease. Infected person at all stages of the disease. And maybe asymptomatic virus carrier. Asymptomatic virus carrier. Infected person and asymptomatic virus carrier. Ways of HIV transmissions. These include the main ways: parental route of transmission. Then virus passes passes directly into the bloodstream. Parenteral route is associated with transfusions of infected blood or its companions, injections with contaminated instruments, especially when using drugs, organ transplantation, or tissue donors. This is parenteral route. Next is sexual transmission or contact sexual transmissions, characterized by the penetration of a virus into the body through damaged skin and mucous membranes, or maybe virus enters during sexual intercourse through the microinjuries on mucous membranes. And next ways transmissions: transplacental from the mother to child during pregnancy and with milk. Transplacental from mother to child. You can see concentrations of the virus in different elements. For example, the very high concentration in blood, when semen and vaginal fluid and amniotic fluid and saliva. The most high concentration in blood. What was the main pathways? Parenteral. Risk groups for HIV infections. Risk groups: narcomaniac, injection uses of psychoactive substance. Next, persons who have undergone invasive therapy, blood therapy, blood transfusion, hemodialysis, dental care, invasive therapy and operation. Next, surgical medical staff and persons are leading a hectic sexual lifestyle. Clinical classifications of HIV infection. Clinical classifications or period of disease. Periods. There are 4 periods. Incubation period. Next, persistence, generalized lymphadenopathy. Or stage of primary manifestations. Next periods: stage of secondary disease, or AIDS-associated complex, stage of secondary disease, and finally terminal stage, AIDS, acquired immunodeficiency syndrome, terminal stage. Characteristics. Let's discuss characteristics for each periods. Incubation periods can last from several weeks to 10 years. Maybe 10, maybe 20 years. Depends on the ways and nature of infection. Depends on the ways and nature of infections, and depends over infections dose and initial state of immune system. Symptoms include non-specific symptoms in incubation periods, such as fever, weakness, headache, sore throat, myalgia, arthralgia, lymphadenopathy, and macular-papular rash. Non-specific symptoms. From the 6-8 weeks of the disease, in the blood appear anti-HIV antibodies. Anti-HIV antibodies in the blood. Next period. Persistence generalized lymphadenopathy. Characterized by persistence more than 3 months, increase in various groups of lymph nodes. Characterized by persistence, increase in various groups of lymph nodes. Due to a non-specific hyperreactivity of B cells, manifest by the follicular hyperplasia in lymph node. Durations of the stage is 3-5 years. Next periods. AIDS-associated complex or pre-AIDS. AIDS-associated complex occurs against the background of a moderate immunodeficiency. Characterized by lymphadenopathy, fever, diarrhea, and loss of body weight. And in this period appear tendency to the development of secondary infections appear secondary infections. Maybe respiratory viral infections, pyodermia, or herpes infections. Final period, terminal periods, acquired immunodeficiency syndrome. Acquired immunodeficiency syndrome. This is terminal stage, characterized by opportunistic infections and tumors, malignant tumors. Last up to 2 years. The amount of anti-HIV antibodies decrease. Amount of anti-HIV antibodies, HIV antibodies decrease. May not be detected at all in the final. Stage. And number of viral antigens increase. Viral antigens increase and anti-HIV antibody decreased. About opportunistic disease, opportunistic infections, the main specific symptoms of acquired immunodeficiency syndromes. Opportunistic disease. Disease was pathogens are activated by reducing the body deficiency. Caused by protozoa, for example, pneumocystis, toxoplasma, cryptosporidia, fungi, candida, cryptococcus, maybe virus, cytomegalovirus, herpes virus, bacteria, Mycobacterium avium intracellular, Legionella, Salmonella. These agents can lead to opportunistic disease. Mechanism: total depressions of immune system. Opportunistic disease versus immunodeficiency markers. The risk of development opportunistic infections is associated with a decrease in the level of CD4 cells and the progressions of the disease. Associated with decrease in the level of CD4 cells and progressions of the disease. Characterized by the severe recurrent course and generalizations of the process and resistance to therapy. Severe recurrent course, generalizations of the process, and resistance to therapy. Change in the many organs and systems with opportunistic infections. Change in the brain, eyes, throat, lungs, stomach, liver, and reproductive systems. Clinical problems due to opportunistic infections. About pneumocytic pneumonia. The most characteristic opportunistic infections. In lung tissue, pneumocytes are capable of long-term persistence, being in the cyst stage. In the case of activations of pathogens, hypoxia and pulmonary edema develops. Hypoxia and pulmonary edema. Characteristics: form cellular masses in the alveolar, pleura, cellular infiltrations of interalveolar septa, possible destruction. Macro change, focus of inflammatory and necrosis, and microscopically inflammation. Toxoplasma infection primarily affects the central nervous system, with formation toxoplasma encephalitis, characterized by focus of necrosis and abscess formation. Toxoplasma encephalitis, focus of necrosis and abscess formation. Next, opportunistic infections, cryptosporidiosis, intestine, in this case intestines affected, formation colitis, enteritis, and clinical manifestations, profuse diarrhea due to cryptosporidiosis. Candidosis, fungal infections, candidosis, localizations of mucous membranes, esophagus, trachea, bronchus, and lungs. Cytomegalovirus, most typical cytomegalovirus, can lead to retinitis, esophagitis, gastritis, colitis, pneumonitis, hepatitis, and encephalitis. And herpetic infections, herpes infections, characterized by long-term damage to the mucous membranes and skin. Herpes infections, long-term damage to the mucous membranes and skin. Toxoplasmosis, change in the brain, specific inflammatory reactions in histology. Candidosis on the mucous membranes, whitish spots, whitish elements, candidosis. And herpes infections, change on the skin with deep ulcers. And malignant tumors and HIV infections in terminal periods, formation malignant tumors characterized formation Kaposi sarcoma and malignant lymphoma, specific malignant tumor and HIV, Kaposi sarcoma and malignant lymphomas Burkitta. Kaposi sarcoma, malignant multifocal tumor of a vascular origin, malignant multifocal tumor of a vascular origin, affects the skin, mucous membranes, and internal organs. Manifested by papule spots, plaque, and knots. Spots, plaque, and knots with ulceration. Microscopically, tumor consists of multitude of nearly formed, chaotically arranged thin-walled vessels. Multitude of nearly formed, chaotically arranged thin-walled vessels, and bundles of spindle-shaped cells. Macro change in Kaposi sarcoma of Kaposi, sarcoma Kaposi, elements, spots, elements, different size on the skin and trunk, and localizations on the face. And microscopically, massive proliferations of spidal cells with clusters of red blood cells. Red blood cells, accumulations, formations with element. And malignant lymphomas, Burkitt's lymphoma, predominantly B cells lymphoma, B cells predominantly, often located outside lymph nodes, affect the central nervous system, digestive tract, upper respiratory tract, and bone marrow. Localizations for lymphoma, malignant lymphoma. Central nervous system, digestive tract, upper respiratory tract, and bone marrow. Lymphoma Burkitt's lymphoma. The main factors in the development of lymphoma in HIV infections is the stimulations of the B cells components, of immunity at a contact level both by the human immunodeficiency virus itself and by opportunistic infections, which directly leads to an increased risk of leading to malignant cell transformation. Increased risk of malignization due to immunodeficiency and formation opportunistic infections. Microscopically in lymphoma Burkitt, histological examination, you can see neoplastic cells with signs of atypism, neoplastic cells, polymorphism and hyperchromious nucleus, and pathological mitosis in neoplastic cells. The causes of death in HIV infections and in terminal stage, especially opportunistic infections and generalizations of tumors and different secondary infections. Dear students, today our lecture is finished. Thank you for your presence and goodbye.